Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Childhood depression, often overlooked, is a pressing concern that can profoundly impact a child's emotional and social development. Unlike occasional sadness, it manifests as persistent feelings of hopelessness, withdrawal, or irritability, affecting daily life and future well being. Our discussion aims to illuminate the complexities of childhood depression by exploring its manifestations, impacts, and the essential strategies and resources needed to support these vulnerable young individuals effectively, ensuring they find strength, hope, and a path towards healing. By fostering awareness and equipping parents, caregivers, and even educators with practical knowledge, we hope to empower them to nurture resilience and help children achieve emotional well being. Welcome, everyone. I'm Dr. Samya Saluja from Tip Media, and today we delve into a critical and sensitive topic: managing depression in children. And to guide us through this complex issue, we are honored to have with us the esteemed psychiatrist, Dr. Rahul Chandok. Dr. Rahul Chandok is a distinguished psychiatrist with over 27 years of experience in mental health and behavioral sciences. Sir is currently working as the head of psychiatry and senior consultant at Artemis Hospitals, Gurgaon. His expertise encompasses a wide array of psychiatric disorders, including schizophrenia, bipolar disorder, obsessive compulsive disorder, depression, anxiety, and substance abuse disorders. Throughout his illustrious career, Dr. Chandok has held pivotal roles at esteemed institutions such as AIMS, Safdarjung Hospital, and VM Medical College in New Delhi. Sir earned his MBBS from MKCG Medical College, Beharampur, Orissa in 1998, followed by an MD in psychiatry from Baba Farid University of Health Sciences in 2002. In addition to his clinical practice, Dr. Chandok actively engages in community outreach, conducting continuing medical education sessions and patient awareness programs across Delhi NCR. A former Paul Harris Fellow of the Rotary Club, Faridabad Central, Sir is also affiliated with the Indian Psychiatric Society. Sir's commitment to advancing mental health care and his compassionate approach have earned him recognition and respect among peers and patients alike. Sir's dedication continues to inspire and positively impact the field of psychiatry. Dr. Rahul Chandok, Tip Media welcomes you, sir.
Thank you. Thank you for the warm welcome.
Thank you so much for joining us today, sir. We believe that depression in children, particularly in this era, it has become a very significant concern that affects not only the young minds, but also their families and the communities. Right, sir? So, to initiate our discussion on this critical yet a very sensitive topic, I would like to begin by asking that are children at a higher risk of developing depression, and how is it different from the depression you might be coming across in adults?
So it is not that the children are more prone for depression unless until there are a given set of circumstances. Okay,
Ji,
because they are usually involved in their various activities, and so they remain distracted.
ji,
Okay, and the responsibilities are mostly shared by the adults.
ji,
Okay, so it is not that they are more prone. While
ji,
if you compare with an adult life, naturally the responsibilities are more.
ji,
Okay, and in a working life, that along with the home issues, you have work stress also.
ji,
So comparatively, the stress definitely in an adult life is much more.
जी,
But at the same time, uh, in teenagers at least,
जी,
the stress levels can reach the level of stress in an adult.
right,
Depend uh, what kind of studies the teenager is doing. Okay, what is the ambition? What the teenager wants to achieve? What sort of relationship the teenager shares with the parents and siblings and so on.
जी, sir.
Right.
And like you've just said, that teenagers are comparatively at a higher risk, of developing depression. So I'm sure it must be very, very challenging for parents in particular, to understand their mental status. So it's for them now that how can parents distinguish between normal sadness and clinical depression in children, or let's say in teenagers?
So you see, distinguishing between normal sadness, which we experience from day to day, and
Right.
especially teenage girls can have premenstrual syndromes during their periods. They're not well adjusted to it. Then it is more likely. So there are various stages where a teenager might feel sad. Okay,
Right.
but that sadness is not all encompassing. Means it does not affect the sleep. It does not affect the appetite. Okay,
Right.
uh, it might come and stay for a brief period of time, and then when the child meets his or her friends, the child might become normal. Okay, the child might
जी,
play with normally whatever
जी,
games they want to play. So
जी,
in normal sadness, okay,
जी,
that
जी,
persistence, the intensity is not there.
जी,
While in clinical depression, okay, there is not just sadness, there is
जी,
lack of interest in activities, whatever the person does regularly. Then
जी,
there is disturbed sleep, either
जी,
increased or decreased, disturbed appetite. There
जी,
might be a feeling of guilt. Okay,
जी,
the person might become restless or very quiet.
जी,
Okay, and at the height of it, the person might get self-harm ideas.
right, right,
Okay. So,
right,
which is very different from a normal sadness.
right. Right. And I suppose that probably this is the time when, parents really, really need or they should seek for professional help, I suppose, especially with the acts of self-harm, where the child needs a psychiatrist or a mental health expert like yourself. Right, sir. So, again, now the ones who actually reach out to a psychiatrist, the parents, with the child. So, what are the recommended treatment options for childhood depression and how do they actually work?
Before we go on to treatment, okay, uh, I would like to mention that a lot many people, when they observe symptoms of depression in their children or in their siblings, uh, they don't understand that you need only 2 weeks for a diagnosis of depression. If the symptoms
Okay.
persist beyond 2 weeks, then you should
Right.
definitely seek out help.
Okay. Right.
Okay. Sometimes they will keep on delaying the things. They will try various things, whether religious or spiritual or counseling by the parents,
Right.
without knowing that if the intensity matches the diagnosis of depression, then
Right.
a consultation should be held
Right.
if it is more than 2 weeks. Okay.
Right. Right, sir.
So when we talk about the treatment aspect of depression in children,
G.
you see, the modalities remain the same for both children and adults, but
G.
we prefer, depending upon how intense is depression, we prefer counseling work or non-medicinal methods to be used first in children,
G.
because not only the child is very anxious, even the parents, the decision maker, is very anxious that the child should not receive any medication, or there should not be any side effects, or there should not be a prolonged course of
G.
medication, which usually happens with depression.
G.
So in majority of the cases, the parent also requests for counseling to be used for management of depression, and we also prefer. But
जी,
in certain circumstances, if the child is very anxious, is not able to sleep, uh, has indulged in self harm,
जी,
okay, uh, or is not eating properly, then
जी,
definitely medicine has to be
prescribed.
given its due, okay, and it has to be considered along with counseling.
जी, जी, sir. And like you've just mentioned, Abhi, parents they tend to delay the doctor's visit because of the spiritual reasons, or let's say societal pressures, and I mean they could have their own individual reasons for not visiting the doctor on time. So I'm sure there might be some long-term implications of ignoring depression on a child's development and future mental health.
You see, depending upon the intensity,
जी,
okay, at least whosoever is aware,
जी,
they ultimately reach a doctor, at least their family doctor.
जी,
Okay. But at the same time, if for some reason the child has not doesn't get any support from a mental health professional, then it
जी,
can have long-term implication also. Like so many children give up their studies. Okay,
जी,
they lose interest in it. Okay,
जी,
and their whole idea about the world, their parents, and their environment can get very
जी,
biased, very colored.
जी, जी,
Okay. A
जी,
person who is in depression sees everything around him or her as black.
right,
Okay.
right,
Like, I am bad, the world is bad, the future is also going to be bad.
right,
There is a sense of hopelessness and helplessness.
yes,
Okay. And
right,
the person remains gloomy, doesn't take initiatives.
जी, जी,
Okay. So these are the implications of not getting a person treated.
right, right, sir. And now coming on to something that most parents, I suppose, would prefer, and that is, managing their child's mental health probably at home first. So, what role do parents and guardians they play in managing a child's depression at home?
You see, in mental health issues, we lay a lot of emphasis on the family members or the caregivers, okay?
Right,
Because
sir.
we prefer that the patient should not be handling the medicines on his or her own. There should be a discipline. Okay.
जी,
Suppose the person is attending counseling, then the session should not be missed.
जी,
Okay. The person should be having adequate sleep, which is
जी,
to be ensured by the parents only.
जी,
The patient should be taking a healthy diet, again, to be ensured by parents. So they have a big role to play.
जी, जी,
Okay.
जी,
It is
right,
not just that, okay, you have visited the doctor and or you have taken your child to the counselor and the thing is done.
right.
A lot many times the counselors give homework
Okay,
which needs to be done.
okay, right,
Okay.
right,
And because in mental health issues, we rely a lot on the information which is given by the informant. We don't have tests that, okay, we will put you in a CT machine and we will get some answers. That is not possible. So they
जी,
have to be observant and they have to give us
right,
information. And in return, we also basically tell them that they have to give the medicines themselves, and
जी,
the child should not be left alone.
जी,
And the child must get adequate sleep, adequate healthy diet,
जी,
okay, like that.
जी, जी, sir, जी. And it just mentioned that, mostly when we're dealing with mental health conditions, particularly in children, doctors rely on the informant's information. The history depends, in their hands. So, could you suggest some resources or support networks that could actually help, or which are available for parents of children who are, struggling with depression, so that they could give better information to their doctors that would actually, foster a better communication between the parent and the doctor.
So you see, support groups and all are quite Western concept
Okay.
because there people are very comfortable talking about their mental health. While
Ji,
uh, in Indian subcontinent, we still come across a lot of taboo.
ji,
Okay, so people
ji,
don't want to disclose their identity. They don't want it to be a known thing that yes, they are their child is undergoing such a issue.
ji,
Okay, but at the same time, there are a lot of resources available to read and to study.
ji, ji,
Okay, I think
ji,
all the doctors maintain their websites, and you can read about
ji,
it. Nimhans is doing excellent work on
ji,
public health education. So you have their website, and
ji,
they keep on addressing mental health issues
ji.
in their sessions. Okay, so
Right.
if you want, there is a lot of material available, no doubt
Ji,
about it.
ji,
But
ji.
yes, we still lack the support group in the support group areas.
Okay. And like you just mentioned that support group areas are a Western concept and we still, need to work for them in India. And then how about schools and communities where children, they basically spend most of their times? Can schools in particular contribute to the support and management of depression in children alongside parents?
Yes, definitely. That is an area where a lot of work is being done. I think
Ji,
all the private practitioners do their meetings in school where they try to make the teachers aware, okay,
ji,
and at the same time, students and parents are given sessions about
ji,
mental health wellness, okay,
ji,
so that the awareness goes up. So, school is definitely an area where whatever work we do, it is going to stay
ji,
with them for life,
ji, ji.
right? So it is
Right.
like what happened in COVID. Like we taught people how to recognize COVID.
Ji,
Okay. So, and
ji,
then they were able to come forward with the symptoms. In the same
right.
manner, if we teach children how to recognize depression, they might
Ji,
be able to report their own symptoms as well as their friends' symptoms. And if even if somebody in the family is having such things,
right. So,
because it is not difficult to teach how to recognize depression.
right. Right.
So school and community definitely has a big role to play.
जी सर जी and abhi जैसे कि we still know that mental health awareness it still needs a lot of working, especially in terms of raising awareness. So how does parental health literacy impact the early detection and management of childhood depression?
You see, basically, it all depends definitely on the parents' health literacy level. It is not
जी
that whether they are uh, literate or not,
जी
whether they are aware about the health issues or not. That is more important. A lot many
yes
times, people who are illiterate also, but if they are aware, they have seen
जी
somebody going through it in the
right
family, then they are aware that yes, there is also such a condition and
जी
which can be dealt with by treatment. So
जी
you don't have to give up hope. So naturally, being health aware
जी
plays a big role. Okay,
जी
and that
जी
is how. So a lot many times also it is seen that if the family is not able to recognize symptoms of depression, sometimes their family friends, sometimes their neighbor are able to guide them
right
because
right
they are aware of such a
जी
situation.
जी जी So I'm just going to conclude this wonderful session, sir, with a very important question that what should a comprehensive to-do list for parents include when managing a child diagnosed with depression?
See, first and foremost, the parent has to understand that depression or anxiety is like common cold. It can happen to anyone.
Yes.
Okay. And suppose it has happened to your child, uh, and you have got the child treated, it is not that it cannot happen again.
Yes.
Okay. So if the doctor says that the child should take a full course of treatment, you
Ji.
have to ensure it.
Right.
Okay.
Ji.
Whether it is the treatment is being done by counseling or by medication or a combination of both, you have to ensure that a proper course is
Ji.
done. Okay.
Ji.
Because
Right.
maintenance is very important in the treatment of depression.
Ji, sir. Ji.
Okay.
Right.
And
Right, sir.
at the same time, the responsibility of medicines is with the parents. Okay. The child is not to be left alone. Again, the parent have to play a role.
Right.
The child should get proper sleep and proper healthy diet. Again, the parent has to play a role.
Ji.
Okay. They are the
Right.
biggest supports.
Right. Right.
So
So,
these are the tips I would like to give.
right, sir. So first and foremost, accepting the fact that mental health is, as common as a common cold, and then adhering to your doctor's instruction and being, the constant support in your child's life is actually the key to deal with depression, particularly in these early years. How
Yes.
wonderfully put, sir. Very beautifully put. So I really appreciate your presence with us today, sir, on this particular note. And I'm hoping that the enlightening information shared, it will be valuable to many families out there. So thank you so much for joining us today. It's really been a pleasure.
Thank you. Thank you.
Thank you.
Goodbye.
Thank you so much, sir.
Bye-bye.
Thank you. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir. Thank you.
Right. Bye-bye.
Bye.